Hey everyone, my name is Dr. Dolores Tarver. I'm a licensed psychologist here in Georgia, and it is time for the Tea. Tea Time with Dr. Tarver is a wellness-based podcast. It is not intended to be a substitute for a relationship with a licensed mental health provider. Welcome back to our December series, which is focusing on health and healing during the holidays. We have talked about how to manage financial stress so that you don't get overwhelmed and overexpend your time, energy, or resources over the holiday season. We talked about experiencing breakups and losses going into this holiday season, being unpartnered. Last week, we discussed men and their health issues during the holiday, and I am so very excited today as we discuss women and our self-care. So you all know I don't like to waste time. Let's go ahead and get into it. It is my sincere pleasure to introduce Dr. Katrina Strozier, who is a native of Kansas, a local obstetrician and gynecologist. She graduated from Langston University in 2003 with her BS in biology. She earned her doctorate of medicine from the University of Kansas School of Medicine in Kansas City, Kansas, and completed a residency in obstetrics and gynecology at Morehouse School of Medicine. She is a member of Alpha Kappa Alpha Sorority Incorporated, Jack and Jill of America Incorporated, the Georgia OBGYN Society, Columbus Fort Benning Medical Society, AAGL, which stands for Advancing Minimally Invasive Gynecology, and Muskogee County Medical Center Society. During her spare time, she enjoys spending time with her children, Stacia, age 13, and Nigel, who is 6. And she loves church, reading, shopping, working out, and music. My kind of woman. Her personal views in medicine are as quoted. I believe in active patient involvement with management of medical conditions and that decisions are made jointly between the provider and patient. Welcome to the show. How are you?
I am great. Thank you so much for having me on your show. Of course, we talked a little bit a couple of weeks ago about, just mental health, overall women's wellness. I think I did a talk on menopause at that time when I first met you, but I am so excited to be here to talk with you on such an important topic today.
Thank you so much. So we've got to, I like to ask a lot of questions. So let me
Okay.
make sure that we got time so I can get you in and out of here under an hour. So I do recognize that for a lot of women, when we talk about self-care, women see self-care sometimes as being selfish. And so we tend to be more other focused as women instead of self-focused. Can you talk to our audience about what happens when we focus on taking care of others' needs and neglect taking care of our own?
Yeah, so I'm so glad you brought that up. We have a lot of women who, I see for their annual exam. And I go through the regular basic checklist of, tell me about your diet, your exercise, tell me about this, that, and the other, and everything they can pretty much say, yes, I'm up to date on this, or yes, I can do better in this. And then I ask, but what do you do for you? And they just either sit there and say, oh, well, I go get my hair done, my nails done. I, try to keep up with that. But I don't know about you, but anytime I go to the salon, I am not just focused on myself. I'm still replying to emails, or I'm trying to get charts done, or I'm doing something other than relaxing at the shampoo bowl or sitting under the dryer.
Right.
And even when I go get my nails done, I'm still thinking about what is it that I haven't done. So when I'm thinking about what is it that you do for you, what is it that you do to reset, a lot of women just break down. They just start crying because they're like, I do nothing for me. I don't know who I am anymore. They're constantly waking up early to try to figure out how to put something else in for somebody else. They are often the caregivers to aging parents. They have children that may be school aged or grown and young adults who are still trying to figure out where they are in life. And let's just be very frank. The pandemic has caused all those additional stressors to compound. So what happens when you're not putting self first, you're going in autopilot. And just like if a car is riding in autopilot, or if the plane is riding in autopilot, it's only so much that can happen. It's only so much turbulence a computer can figure out. There's only so much that a robot can continue to do before it breaks down. And for a lot of families, the woman, the mother, the whatever your figure is in that family, you're the glue that holds things together, and the whole system breaks down. So if you don't take care of self, not only are you not doing what you're required to do for self-love, you are not providing the appropriate channels for other people in your family to be sufficient and know what to do to take care of you.
Well, first of all, you didn't have to ring my doorbell talking about that I'm doing stuff at the nail salon that's work related and not actually relaxing. But this not about me. So, but I do recognize that often you're absolutely right. When we say we're engaging in self-care, we're really multitasking. So it's like, oh, hey, I have a moment. Let me send this email. Hey, I have a moment. Let me text. Oh, I'm on this committee. Let me go ahead and make a few phone calls while
Yes.
I'm in here. And so we're not actually fully taking advantage of those opportunities. And I got tickled because that is the most common two things that I hear when women, I ask them what their self-care is. Oh, I go get my nails done. Oh, I go to the hair salon.
That is
Um,
not self-care. That is maintenance, boo. That's mandatory.
Come on and tell the people like, hey, I appreciate you looking good, girl. And at the
Yes,
same time, how is that pouring into you? How is that
exactly.
releasing you? How is that
Exactly.
allowing you to be able to take off some of those titles, grandma, auntie,
Right.
mama, committee
Yes,
chair? I saw the organizations that you were involved in and it made me tired. I said, ooh, that sounds like a lot of work.
it is. Sometimes it is. And so, that's the other thing that you're talking about. Like, okay, we are involved in a lot of different organizations because that's what you're kind of trained to be a part of. And a lot of organizations stand for your principles that you grew up around, or that stand for what you are, your purpose and your cause. However, when we are looking at that, I have a lot of people that say, oh, I've cut back, or I'm not doing as much as I used to do, but I'm still tired. And so, doc, I need you to check my hormones. I need you to check this. Well, I cannot fix a tired soul. If your soul is tired because you are still unrestful, you can be sleeping, but still have so much that you haven't unpacked emotionally. That's the dinger.
Mhm.
That's the part, that's the self-care. And so while you might be checking off a list, like, yes, I'd rather go to the salon and do my hair myself. However, I'm not really relaxing and saying, hey, let me do an emotional self check. Let me do a mental health check for myself. Am I okay? How many times do we just stop? How many times do things happen in life and you really don't get a chance to process it? You just keep going. And then you realize relationships may be a little different when it comes time to, like, maybe some things happen over the last couple of months with maybe a family member or a good friend. And those things weren't resolved, but you have issues and you've kind of moved past them, but then you're getting to the holidays and you're going to spend time, but you have some undealt baggage. And so then you have maybe a little anxiety that's building, or maybe you really are saying, did I read that situation right? You have a lot of overthinkers.
Yeah.
Did I read the situation right? But you don't get a chance to really sit with yourself until you have quiet time. And so whatever that looks like, whether it's yoga, whether it's Zumba, or whether it's just saying at a certain time of night, I'm going to disengage from all social media, my devices, my TV, and really either read something that's going to help better me, or just take some time to meditate, reflect on my day, and just really think about me, not just a checklist of things that I have to do tomorrow, but actually unpacking what is going on in our emotional state, our mental state, our maybe even our family, our dynamics with our children, our dynamics with our spouse, our parents, or just, saying, I really am not okay with what's happening, or there are some things that are out of my control, and maybe I need to assess if I am handling these correctly. And if I'm not, what are my options? What are the next steps to getting some help, to making sure that I'm, number one, not spiraling out of control, but I'm actually doing it correctly. There are there are people, there are specialists that are well trained to help people during different phases in their lives.
Doc, we're getting ahead of the slides. Yes,
I didn't even pull them up. I'm
no,
just
you're fine.
talking.
I'm teasing. Yes, I wanna, I actually wanna back up a little bit because you mentioned something that I think is very important for women to hear, which is you said we take these things on because they're of significance to us. Maybe they're in alignment with our values. Maybe they're in alignment with what we've been taught growing up in our families. Maybe they are in alignment with what we feel like, hey, to whom much is given, much is required. But that leads us sometimes to get in roles where we may feel obligated.
Mhm.
We may be in roles where we're doing things that give us meaning and purpose, but then we're taking on so many of those things that it can end up becoming draining to us. And so now
Mhm.
it's not as purposeful as it once was. Now it feels like one more thing I have to do on my checklist. So talk a little bit about, some of the reasons why, as you're talking to some of your patients, they're saying, oh, I don't know that I can give any of that up, because I know that sometimes that is a conversation that we end up having. Like, what's going on in your life that's causing
Right.
you all this stress? And are there some ways you can lighten your load? What are some reasons why we're maybe holding on to things and we have difficulty being able to relinquish some of them?
That's really good, and it's a very loaded question. So I will just I try to look at patterns when I take care of patients, and I try to
Mhm.
remember certain conversations because there's nothing new under the sun. And most women are dealing with the same things, and actually, probably men and women are dealing with things a little bit differently, but there are a lot of commonalities. And some of the most common things that I am seeing are taking care of family members, and they may be grown children, they may be aging adults, whether it is the most responsible person in the family is taking care of grandma or great auntie. And why you? Well, because no one else will do it. Or, well, because so and so else is not responsible. Or, you know what, if it don't get done, if I don't do it, it doesn't get done right. And I just want to know, where did we create these standards? Or maybe you are right. Maybe your family dynamics are such that you are the most responsible, or you may be the only granddaughter or niece who is in the family who could take care of an auntie. Um, However, I do think we have to expand our minds and figure out, how is it that I am the only one who can do this, but also open my mouth and ask for help. So we start kind of picking apart the situation, like, okay, do you have to be the only one that can drive this person so and so? Or do you have to be the only one that can cook? Can you outsource? Instead of cooking, can somebody else cook 2 days a week? Or can you order out a couple of days a week? Do you have any friends that may be open to sitting with this person? Looking at the entire schedule, looking at your resources within your own job or your whatever your schedule looks like, and seeing, do I have space in my time? I talked to one woman and we literally picked apart her entire day. She got up at 4:30 because she had to be at work at a certain time. She had a mid-morning break. She would come home and start the dinner so that it could be ready in the afternoon. I said, you have to cook. Well, my husband won't eat leftovers. He won't do this. Well, have you talked to him about the stress that life is putting on you with taking care of your grandmother and maybe even an uncle who may be in and out of the hospital at times? Have you talked to your grown children? Yeah, talk to them. They won't do anything. Well, at some point, there still has to be enough self-care that says, I cannot continue to do it this way. There has to be a coming to Jesus,
Come
meeting
on,
with the
Jesus.
family or even yourself to say, I cannot take this on. Let me reach out to maybe home health agencies, or maybe even just the patient's doctor. Sometimes you may not know what all resources are available. But then also, um, once I tell people to talk to a therapist or a life coach or something, there are some different options they have not tapped into. Other things I see are moms who have to run their children around to all kinds of activities. And I'm one that has children that are very involved in every kind of sports activity, a social activity. And I just feel like I'm constantly running around. I'm chasing their schedule, I'm chasing my schedule. And there are days that I'm just like, you tired? I'm tired too. We're not going. And it's okay. Like sometimes
Mm.
you have to draw a line in the sand and just say, you cannot make everything. You cannot be at everything. And that wellness is important. If your body is tired, listen to it. Well, I'm going to push my children to go to something just because I'm paying money for it. If they say they're tired, you know what? Sometimes they really are. And also just prioritizing. What does life look like? You know, we say that we are a society oftentimes that puts God or their spirituality first, but oftentimes that gets left to the last of our days because the schedule is dictated by others. And so you usually try to make it on time or when something is happening. And if you don't start your day with either something refreshing, something spiritual, you may miss out on that very key element that has held the glue together in your life for so many years.
I want to thank you for covering so many different things that I think probably hit every woman who is in the sound of your voice. Um, I hear the same kinds of things about no one else will do it, or well, I don't want to push them out. They're not quite ready to leave the nest yet. I don't. I'd be worried about them, or well, grandma, she doesn't like anybody else coming to the house. She doesn't like anybody
Mhm.
else's cooking.
So they kind of
Uh,
own that too. It's kind of like a badge of honor
oh
too.
yeah, absolutely. And and it is very tough to talk to people about, like, I know you love grandma. You do know that people will treat you however you allow them to treat you.
That is true.
Um, and as much as we do not like to acknowledge it, our kids and our loved ones know how to manipulate us.
They do. That
And
is very
so,
key. Hmm.
my dissertation was actually on caregivers. And so I got a lot of research participants from this caregiver group, and it was African American caregivers and predominantly women. Some the oldest in the family, the responsible ones, like you were just
Hmm.
talking about earlier. And one of them had had a stroke. And the reason she had a stroke is because of all of the stuff that you just said. She was getting up at 4:30 in the morning. She's going to work. She's coming back home to check on, it was her mother who she was caregiving for. Then she's going back to work. Then she's picking up kids. And and she had 11 siblings,
Wow.
right?
11 siblings.
11 siblings. But she had taken ownership of, well, nobody else, right? So nobody else had to do anything
Hmm. Nobody
because,
else had to.
no,
Nobody else
right?
was given the opportunity.
Absolutely. Absolutely. No one cooks like you, and that's okay.
It's
Taste,
okay. Everybody
taste
don't have to
buds,
have that meal.
they don't. Taste buds actually will adjust.
They will. Because I'm sorry, when you get hungry, at some point, it doesn't matter how good it tastes. It's
Absolutely,
sustenance.
absolutely, absolutely. Those leftovers hit real nice
They
uh, when
do.
when you're hungry, right? But if I do not give people an opportunity to adjust, then they're not. And so here I will be ending up having a stroke, unfortunately, not speaking that over anyone's life, but
Right.
having some kind of health issue because
Yes.
I've neglected myself. So I thank you for sharing. There will always be a reason that you could justify
It
not
will.
lightening your load.
Absolutely. I mean, when you start talking through it, though, I think sometimes when people speak it out loud,
Mhm.
there is something about speaking it out loud that sounds worse than just what you're doing daily.
Mhm.
When you actually own the schedule, when you actually own the reasons why you are doing what you do, somewhere in there, there's self-realization. There's a light bulb that goes off. It's magical. I don't even have to do it. I just say, tell me what your schedule is. And then they just start crumbling like, oh my gosh, it is too much. When I
Mhm.
say it out loud, does it sound that bad? Yes, it
Yes, it
does.
does.
It does, but it's okay.
Mhm.
Once you recognize that it is not okay anymore to carry this weight, you can begin to find solutions.
Absolutely. And you gave a lot of good ones. Like you talked through a lot of there's resources out there. There are agencies and people who will bring food in.
Mhm.
There are people who will help you clean. There are people
Yes,
who will help you transport. There are people who will give you respite. So if you are one of those caregivers that has to stay with someone because they need full-time care, there are people who will give you respite and you'll be able to leave. Now it is going to be
mm,
incumbent upon you not to answer your phone while you're on
right.
your vacation, because again, your loved one will try to say all of the stuff to bring you back home. And then you get back and you
Exactly.
realize nothing was wrong with them,
Exactly.
except for they just didn't want you to be gone on vacation. But yeah, you
Mhm.
gave a lot of good help. And I think sometimes people don't realize what their options are because they've closed
Mhm.
themselves off to
Right.
potential options. Talk to me about why it's not selfish to get that support.
Ooh, ooh,
Why is
ooh,
it
ooh,
not
ooh,
selfish
ooh, ooh.
to change that schedule and lighten that load?
So, mm, I think when we are trying to, number one, um, talk about the word selfish, people oftentimes impose their own views on people who choose to do something other than something for them.
Mhm.
Oh, well, I needed to do this, but you went to get your hair done. Oh, I needed to do this. Oh, but you had me a little late because of X. Let's stop. Let's rewind because you do so much for everybody else. And so taking the time to push pause and say, hey, I have to do what I have to do for me, because if I'm not here, if I'm not mentally here, if I'm not emotionally here, I can't be everything I need to be for everybody else. You're going to crumble. I see so many people who are just, like you said, working, working, working. The idea that I'm doing something for myself, it's almost like people feel like, well, if I'm not doing for everybody else, I'm not um, either adequate or doing what my mom did, or like, just because everybody before you did it a certain way doesn't mean that that was necessarily right.
Or healthy.
And you don't have to be a martyr for the cause. That's my
Mm,
big word. That's my
mm,
big thing.
mm.
You do not have to be a martyr for the cause. You have a lot of families that are operating from different perspectives. And when I say this, you may have somebody who was used to being a part of a nuclear family with two parents who shared household chores and both worked, or a traditional where dad worked, mom stayed home. And then you're blending this to a lot of times where both people are working and there are different ideas of what is acceptable for your household roles. Or maybe you're a single mom and you're doing it a certain way, and maybe you have the same expectations of what your mom did or your grandma did or what you saw people do around you that you respected. And so you create these expectations. And then you also have other people's expectations that come into your decision making. And so when we're looking at how we are, what we're doing, why we're doing it this way, we need to take a pause and say, look back at so and so that you created this whole narrative in your life, these whole expectations, and see, are these really good expectations? What are the unspoken words behind what that life looked like for that person? And when you start looking at things, you start digesting it, you start talking to women. We don't also talk about
Mm-mm,
things. What
mm-mm.
what goes on at home stays at home. And so you can't get any progress unless you start asking people, how are you doing this? How were you able to do it? I started having very candid conversations with women in my family, and they said, oh, it was insane. I don't know how I did it. Well, why were we doing it? Why?
Absolutely.
So really taking a step back and writing out, speaking out loud. what are our priorities? There's absolutely nothing selfish about saying, I need to do less, or I need to do things differently. I can use myself as an extreme prime example of what I've done. So I was in a very busy hospital-based practice for about 8.5 years. And I just kept waking up like just drained. And I love my career. I love taking care of patients. But the hustle and bustle of how I was doing things, just going from call to call, from delivery to delivery to, okay, home, bath time, meal time, it just became so monotonous. And even just getting up to work, for me to work out, I would have to get up at 4:15 in the morning to get, to the gym, to be working out at 5 to 6, and then chart from 6 to 7 to get back home and take the kids to school, and then get back to the office to start seeing patients. I've already done 3 to 4 hours worth of work before I even start my morning shift. Most people are starting at 8 or 9 o'clock. But that became exhausting. And so I had to build more time into my schedule. It also became very important to me to build time into my schedule to do more patient education. I realized the issues that were coming to my office. We need more awareness. We need more education, and we need people to know that they're not alone in these struggles. We need more support groups, and we need to find ways to help people outside of medications. A lot of stuff is really psychosocial in what we're dealing with. And so it became so heavy on my heart that I knew I would have to do something different. I decided not to renew my contract. I took a year traveling, doing some, working 3 days a week just to be off 4. It may not make sense to people, but it was the space and the time that I needed to not constantly be in the office, and to actually rest my mind, to do a reset, and to say, Lord, what is it that I need to be doing so that I can be as emotionally available, is mentally available, and producing the things that are in my soul to do, not just working to be working, but to be fruitful in what our message is, what our calling is, what we're doing in life, not just doing in action, but actually fulfilling that task that's in your soul to do. And so that's my story. That's my journey. And it's a whole lot in between there. But sometimes in order to do that, you have to rip the Band-Aid off of life, and it becomes uncomfortable for yourself. It can be uncomfortable for the people around you, and people may not even understand. And I don't have to explain, and you don't have to have full understanding to know that what's okay with me is what's keeping me at peace. And you may not like my change. I'm not changing for the worse. I'm trying to change for the better. And I'm sleeping better at night. And that's the kind of conversation, that's the kind of conviction people have to say, you are absolutely right. I got to do something different. I don't know what it looks like. It might make some people mad, but I got to do it.
Do you want me to pass the collection plate now, or you want to wait until the end? When I tell you that is a struggle that I have, that is a struggle that a lot of my clients have, in terms of being able to have that work-life balance, to be able to have that balance with being a parent, and also being a person, right? So many times we're struggling with trying to keep up with things because other people did, or because that's what we think we should be doing, because we have all this mom guilt, or this sister guilt, or this daughter guilt, or this auntie guilt. And so it is keeping us stuck. And we are active participants in our own victimization, because we say, well, I don't have time to invest in myself. It's not that I don't have time, it's that I haven't made time. Because it would be uncomfortable for me to make that time. It would be uncomfortable to me. So many women say, well, I don't have time to get my hair done, or get my nails done, or put any clothes on, because I'm too busy shuffling kids around, or taking care of parents or partners. Or is it that you don't have time?
That's where that selfish piece comes in, because it's making a choice
absolutely
to choose you
yes
over something else for someone else.
Yes.
And so if the people that are around you, if your choices affect them, and they cannot figure out a solution to either do something themselves that you were doing, to really evaluate and respect that time, that space.
Mhm.
Um, you have to really evaluate, where is the care? Is life reciprocating to you what you're putting out? And
Come
maybe
on
you just
now.
have to evaluate and take a step back. And I realize some people feel like, oh well, I did this for them. Why aren't they doing this for me? Just because you put out that way doesn't mean that others put out that way. Just because you give that way doesn't mean that's how you're going to actually receive. You still may have some things that you're receiving, but it may come 10 years from now, 5 years from now. So the exact measure of what you're doing may not be reciprocated in the manner that you think. And it doesn't mean that those people don't love you, or that they are being somehow inconsiderate. They may not have the decision making or the capability to really comprehend what that means for you. But that's still, you have to decide the weight that you put as far as their voice, their value, how they're showing up for you. If of course, children are selfish. They're
Yes,
supposed to be
absolutely.
selfish,
Absolutely, without a doubt.
but you
Unbothered.
still can teach some healthy boundaries in
By
that.
modeling that, and as you
Mhm.
were talking about, and I think sometimes we overfunction, and so people underfunction.
Ooh,
And you mentioned earlier how difficult it is for us to ask for help. It is incredibly challenging for Black women to ask for help, and so sometimes this prison that we're creating for ourselves is of our own volition, because we have not allowed anyone to assist us. And
wow.
no, they're not going to help in the same way that you help. Maybe because they're not a good fit for you, because sometimes we just have people in our lives that are just draining. Let's just go ahead and be honest, and we're going to be honest.
There we go.
Um, Sometimes we are still carrying friendships from when we were 6 that we should have cut loose
Mhm.
when we were 12.
Yep.
That person hasn't poured into your life in 40 years, sis, let it go. But then sometimes we have to go back to your expectations perspective, because I think that's very important. We have unrealistic expectations that if I pour all of this extra into this person, then people will pour back into me, which isn't realistic because it's not sustainable.
That's true.
So it may be that we need to dial it back.
Hmm.
You cannot bring treats to every soccer game.
There you go. That's right. That's right. And then you over here looking at your budget, and you're like, why is this going? And no one else is showing up. And you get mad because no one else is bringing treats. Well, you
Mhm.
always brought treats. So
You
stop
always
bringing
brought the
treats.
treats. Stop
Somebody else
bringing the
might bring
treats.
treats. That is a very when we're looking at a simple example, that is a very simple, but that goes to show how it can just trickle down into other areas in your life as well.
Absolutely. Now, you mentioned, tired, and I do want to spend some space in that, because I think that that is probably one of the first symptoms that women
Hmm.
may experience. It's like, oh, I'm tired, right? But we don't necessarily recognize the difference between like tired because it was a long day and this chronic kind of tiredness that may actually signal there's another issue going on. Talk about
Oh,
chronic fatigue. Talk about some of the other health issues that could be also underneath women feeling tired.
I am glad you brought that up. So fatigue is like a huge area of medicine that's just kind of like, it can be very vague. Fatigue can be just fatigue on itself, but you could have fatigue with other symptoms. Like if you're going through menopause, you might be, oh, I'm just tired, but I get these hot flushes, and I kind of am a little moody. So that's kind of a syndrome. We can kind of throw that into kind of menopausal symptoms, and there's a whole lot of treatments for that based on the symptoms. Then you also have fatigue that comes with maybe sleep apnea. If you're snoring at night, you may not be getting restful sleep, and therefore you're waking up feeling tired. And that can be diagnosed through a sleep study. There are some people who sleep well at night, but they have continued daytime sleepiness, and they could suffer from narcolepsy or chronic fatigue syndrome. Also, there are autoimmune disorders that can present with fatigue. So things such as lupus, rheumatoid arthritis, um, some of your Graves,
Mm.
hypothyroidism, some of the other hormonal issues that can manifest initially with just fatigue. So oftentimes when patients come to see me and they're just tired, we don't want to dismiss things such as, regular metabolic issues. So we will oftentimes check a thyroid. We might check vitamin levels. You can be anemic. That can cause fatigue. And then once you've had a complete workup, if your labs are normal, if maybe your sleep study is normal, you also have to look at your mental health when we're talking about, depression can present as fatigue. Also, just how much are you really sleeping at night? Doing a good sleep hygiene profile. But what I have seen recurrently, and the statistics that during the pandemic, mental health disorders were, diagnosis went through the roof. We saw more incidences of suicidal ideation. We saw depression, anxiety,
Violence.
and then we saw a lot of domestic violence at home because people could not escape the home, and whatever issues were at home, when people would go to work, you were away, but it was compounded because you were in the home. We saw children committing suicide. We saw the rates of mental health disorders in young children, adolescents, skyrocketing. So we cannot underestimate the impact of what's happening in our psychosocial network. But fatigue, you just feel the need. I don't care how much I've rested, you cannot rest your soul. And that is where it is so vital to talk through the things that are difficult to talk through. I can't, I don't know why. Well, I know we know a lot of reasons why people won't talk to therapists. It has a stigma. Oh, I don't want to talk to a crazy doctor. And I don't think people understand the difference between a psychologist and a psychiatrist.
They don't.
They don't. They just don't. I don't know if you want to share the difference right now, because I tell people all the time, but I want to hear it from you.
Well, thank you. Thank you so much for putting me on the spot. But that is an excellent point, because I do think that, it's very important for people I think people see on TV, and they get a lot of their information from TV and movies, which is a skewed perspective. So the psychiatrist is the MD. They are the ones who prescribe the medicine. It used to be, back before insurance dictated treatment in the way that it does, that a psychiatrist actually provided mental health counseling too. They spent time, were able to spend time with their patients and prescribe medication and talk through all of the things that were going on. But unfortunately, those days are relatively gone. Most psychiatric providers probably have a good 15 minutes other than that initial appointment, and they're really focusing on your medication. How are you doing in your medication? Do you have any side effects? Are you experiencing any suicidal thoughts? Are you having any allergic reactions, right? So we just want to make sure that your medications are doing what they are prescribed to do. Keep a journal track. Let me know how you're doing if we need to adjust the medication. The psychologist, which is what I am, is the person who is going to do exactly what we're doing in this moment right now, which is having a conversation where we identify what is underneath what we're experiencing, and we come up with a treatment plan. In other words, some ways of managing that are going to allow us to meet a goal to reduce whatever it is you're experiencing, whether that's grief and loss, whether you're having a hard time being able to manage your emotional eating, whether you have unhealthy patterns in your relationships, whether you are a person who struggles with work-life balance or balance in general, you're having a hard time getting out of the bed. So we are goal-oriented, which is what makes us a little bit different sometimes than just talking to your friends. We're also a safe space, so you don't have to worry about hearing your business all out in the streets. So you can come in and you can share and be able to have a healthy space where you can focus on you and you can focus on your self-care, and not do what a lot of times we do when we call people and they say, "Girl, how you doing?" You start talking and they make it about them. You get a chance to have this whole session be about you, which is uncomfortable for a lot of women because they're not used to focusing on themselves. But that's essentially the quick and dirty of the difference between the two. And please add.
Yeah, I'd like to add to that. So that is a very good groundwork for exactly where we are. When I think about, when I start talking to people about talking mental health, I usually send patients to a psychologist first, unless they have a known diagnosis of depression, anxiety disorder that had been, difficult to manage, bipolar, schizophrenia, those definitely need to have a psychiatrist. Psychiatrist managing, because usually medications are involved, and even a part of their recommendation may be behavioral therapy that would then be initiated and treated with a psychologist. The psychologists, to me, are they're the people that are licensed. They've gone to school, they have all this training to just be ready to have a conversation on whatever that looks like for you. So like you said, a very safe space. And that's the thing, a lot of people are very apprehensive about going because, like you said, they don't want their business in the streets. Well, we are all tied to HIPAA, which is a law that requires us to keep your information confidential. Now, when we're using examples, a lot of what I say, if I throw a rock into a crowd, might hit a lot of you because it's very similar. But I am not disclosing your name, your identity of that was your situation. So those types of things, we can still help a lot of patients with just kind of using examples, but we're not disclosing your name, your personal information, your phone number. They don't know how to contact. They don't know it was your story. These people are really good at evaluating that. And so I want to hit, since we're talking about mental health and people being apprehensive to going to, seek care. To me, a lot of people that I've seen, they say, oh, I talked to my pastor. And there's nothing wrong with continuing to talk to your pastor, your pastor's wife. There's nothing wrong with going to church and praying. The way I look at mental health counseling is very similar to if you had a cold and you came to the doctor for an antibiotic. You trust the antibiotic to help get through that situation. And so when you are struggling with something that you haven't been able to get past, you should trust that going to talk to a mental health therapist who sees people who have gone through this, they have training. It is like taking an antibiotic. You're getting a dose of mental health therapy from somebody who's gone to school for a long time to help us process the decisions that we make, why we make the decisions, and to help us have behavior modifications to do something different. I really, really, really advocate for our licensed therapists in the mental health field.
Thank you so much for that shameless plug. I appreciate you. I'd want to come see me after that reigning endorsement. And that is also an important part about us working collaboratively together. Right? So we appreciate you all's referrals as medical providers to us, and we appreciate being able to send people to you and say, hey, there are some things that, we're a little concerned about health-wise, medicine-wise. Could you, talk with this person about some of these things? They are not taking their medication as prescribed. They are not. They are telling you that they are being compliant with these things, and they are not doing any of that.
That's so true. So some of the barriers, I know a lot of people are concerned about whether or not their insurance will pay for, therapy with a psychologist. And oftentimes they are covered by your insurance. You also have employers who will also cover so many visits, especially with pandemic. They understood the stressors that the pandemic, COVID, just unpacking what that did. You have people that didn't even bury loved ones in a proper manner. Like, man, the list goes on and on what those couple years did to us.
Let's talk about some of the lasting effects of COVID. I think that's a good segue into that, because I do feel like we are still dealing with the residual health-wise and mental health-wise since COVID. I think a lot of you mentioned suicide, and I think a lot of people were very touched by Stephen Twitch Boss's suicide most recently. And it reminded me of Chelsea Chris, Miss USA, when she completed suicide. And we look at people and we think, like, wow, your life was amazing. How could you end up in this place? And I think we don't recognize the things that are underneath the depths of you mentioned depression and anxiety and schizophrenia. I know people are very afraid of that, bipolar disorder. But in reality, a lot of people are struggling. You just can't necessarily look at a person and see. So let's kind of talk about some of the ways that we've been impacted by COVID.
Okay. So I think when, specifically for me, being in women's health, I have a lot of mothers. We know that postpartum depression affects about 20 to 30% of all pregnancies. So that's a significant number of women, but also whatever dynamics that may be happening, whether it's a loss of a loved one, a job change, any kind of added stressor to that pregnancy can be significant. You have to understand, when we were in pandemic, people could not come to the hospital. This is supposed to be a happy time, but people could not come visit. We were limited on how many people could even be in the hospital. If moms had COVID, initially moms and babies were separated during what should be a very happy time. We had so many unknown variables when it came to how do we even manage it. It affected the healthcare workers disproportionately. We are prided in having the knowledge. We didn't have the knowledge. You guys were getting, the general population was getting the knowledge just like we were. And we were forced to have treatment options and plans that had not fully been studied, but we just had to do the best that we were doing. We were overworked. It was stressful for us. It was stressful to our families. We were scared to come home, scared to pass COVID from our clothes. I would drop my clothes in the garage, come straight to the shower, tell my kids, don't touch me. Kids that haven't seen their mom all day, just the dynamics. Now mom's, ew. So we're looking at those pieces, staying home, financial strain, areas that you may have been very comfortable in your lives were now challenged in different ways. So as far as even just the pieces of getting diagnosed, getting to a doctor, delayed diagnosis, delayed preventative services, that stress affected everybody. And when we look at how we took care of loved ones who died, whether they died from regular illnesses or if it was COVID-related death, we were limited on the number of people who could attend a funeral. Could they even have a funeral?
That part.
And so the soliloquy of, I didn't get to bury my loved one properly. We didn't get to have a service appropriately. I didn't get to have the appropriate service for my baby. Talking through that, looking at how many milestones that may have been missed that were hurtful. We all function normally, but hearing people when you say, what did that mean to you? How did that affect you? Well, let's just have some redos. Let's talk through, what do you need to go forward? And then for some people, it's like, oh, well, that's petty, or that seems insignificant, or I don't want to trouble people. How many times do we not want to trouble people? But if it's important to you, and especially if you think a certain way like other family members think, probably either having another service or a memorial, or saying, we didn't have a proper burial, everybody couldn't come. Well, maybe the next Memorial Day, get together and do something that will make everybody feel better, because bearing these topics is not helping anybody to heal. But we have to start talking about the difficult conversations. We are also getting to a place where you're going to be around loved ones. I can't tell you how many people I have come to their appointment. We talk about family history and they say, oh, they had something. Start talking at the table about what it is that they had. Start talking if so-and-so was crazy. Well, what did they have? Because you know what, if so-and-so, okay, well, they say he was a little quiet, he was a little eccentric. Maybe we do have some mental health in our family that people just sweep under the rug and say, oh, they were a little different, they were strange, they were weird. No, let's start unpacking that. What does that look like? Let's start talking about what cancers are in the family. Let's start knowing our family history. So when you go to the doctor, you can tell us these things that can help us take better care of you.
People in the chat are like, oh, thank you so much. Wonderful conversation, wonderful information. You have
So having those uncomfortable conversations at the dinner table is how we help ourselves currently, but also help the next generation by knowing more, doing more, unpacking and unloading some of those, like you said, very difficult, heavy conversations.
I appreciate that, because one of the things that you highlighted are that there were issues going on pre-pandemic that got amplified during the pandemic. So those conversations that we weren't having, we were not having them during the pandemic, and they got worse because now it may be helpful for us to have known that information, but
Right.
we don't know. And now
Right.
we're isolated and alone because we can't have people there with us, and we're not connected to people, and we're grieving a lot of things. We're grieving our social interactions because we
Mhm.
can't engage in the same way. We're not going to church in the same way. We're not able to even have this service with other people who are grieving, to be able to share in that collective experience. Our kids are struggling. They're
Yeah.
trying to navigate something that we can't help them through because we haven't experienced it. We're
Mhm.
experiencing it with them in real time.
Yeah.
We're trying to figure, where everybody's Googling, trying to figure out what they can do, which, it contributed to what you were saying earlier. Higher suicide rates, more violence in the family. Like, we can't escape each other. Now we don't have a break. Now, when I was able to go to work and get away from you, I don't have that. And I'm realizing all of these issues that we had, like, they're in the forefront now because we're
Yeah.
right here and we can't run from them. And so talking through them, working through them, creating plans, that is really the only way to address any kind of issue. They
Right.
never just go away.
And I think the other thing is to have grace
Come on,
with
Grace.
people, and people
Mhm.
sometimes are just either anti-confrontational.
Mhm.
Just because I address the issue doesn't mean that I am being problematic, but maybe setting the tone so we can get through something that has been troubling me, or
Mhm.
just letting you know that I have some triggers. People have
Mhm.
all kinds of triggers.
Mhm.
People
Mhm.
are not comfortable talking through those difficult conversations, but also, if you care about someone, if you love them, then you need to create a healthy space to have those difficult conversations and to let them know that um, what is going on with them matters.
Absolutely. Absolutely. And we have to get comfortable being uncomfortable.
Yes, yes.
Yeah. So are there any last words of wisdom, websites, books, podcasts, anything you want to share with the audience as we wrap up this very needed conversation?
If you want to reach me on any of my platforms, I am on Facebook, just my name, Dr. Katrina Strozier. I'm also on Instagram. I am also putting forth a little bit of education for our younger girls. I do a little series called Girl Talk with Doc C. I started it. My vision for that was mainly to educate girls on different career paths, encourage them, talk through the puberty years, all the other little roadblocks, and how we can help our girls to be successful. I also do any kind of women's health topic. I will talk with your youth group, your church group, um, your older women, just whatever health topic that comes up. I am usually very open to that. As far as some parting words, to me, I think that everybody just needs to take a little bit of time and journal. Look at what life looks like. Look at what life has looked like in the past and what you want it to look like in the future. Write that out, own it, own the parts that are ugly, cry it out, talk it out. But most of all, just be true to yourself and don't ignore those feelings of insecurity, anxiety. You may not want to label them, but if you're feeling, uncomfortable in situations you used to feel comfortable in, ask yourself why. And you may need to talk to somebody. I think the red flags that you definitely have to seek immediate help is if you are at all feeling like you want to harm yourself, you want to harm others, if you're hearing voices, seeing something that's not there, if people are coming to you and telling you they are concerned, you need to start listening to the people that are around you. No one would tell you they're concerned unless they've paid attention long enough to really care about your well-being. And so, with that being said, seeking any of you have plenty of agencies that you can go to. If you Googled mental health awareness, there were going to be all kinds of websites that come up. There are crisis hotlines that you can talk to somebody 24 hours a day. You are never alone. You can go to any emergency room if you are having any feelings of sadness, depression, anxiety, and they can screen you immediately to see if this is something that warrants an admission or how to get you some help within a certain time frame that's appropriate. But the last last option should be to do anything to harm yourself. So you have a lot of people that love you, even when you don't feel loved. There are so many people who are thinking about you and wanting wellness for you.
Oh my
I don't
goodness,
know, is
that's
there
so
anything else?
powerful. That is, all of that is very powerful, because I think if we had to have a parting word, that for me would be it, is that you're not alone. And there is always a resource out there for you. It's just a matter of connecting with it.
And
Yeah.
don't be embarrassed. You may look at people, don't let this social media hype you up. There are a lot of people who are smiling, just like we have talked about some very prominent, famous examples of people who are continuing to go because that is their job. That is what they're meant to do. But then you take away the cameras, you take everything away, and whatever unresolved issues are still
Still
there.
there.
And so we have to make sure that we're dealing with that, making sure that you build the time to deal with that. And that's the issue with autopilot and not being selfish, is that you overlook everything that you need to be dealing with inwardly. So yeah.
Absolutely. Well, I want to thank you so much, Dr. Strozier, for coming on, dropping all of those words, and thank you for actually pronouncing your name correctly, because my Southern accent with this New Orleans twang, just, so thank you so much for saying it correctly for our viewers, so they will have the accurate way of, I care a lot about people's names, and so I want to make sure. So thank you for saying it correctly so that people have it. Thank you for giving of your time and your talents for Tea Time with Dr. Tarver. We are going to have one more episode that's just going to be focused again on tips for the holidays, a quick 5 for 5 for our last week of December. And then in January, we will be transitioning into some of the things that interfere with us setting our goals and reaching our goals, hitting those roadblocks. So everyone have an amazing holiday. As whatever you celebrate, ask that you and do it safely, and that you do it with people that you love and who love you. So everyone have a great night and be well.
Thank you. Yeah.
Thank you. Take care.
You too.
Bye-bye.